Kuzambo and welcome to BBS. I'm String Dendu. In today's program, we will bring you a discussion on service provisions for persons with disabilities. The program is to make public aware on the service provisions for persons with disabilities by different civil society organizations. To discuss further on this, I'm joined by Sarugin Wangchuk, Ability Bhutan Society, Madam Duptop Zangmo, Disabled Persons Association of Bhutan, and Mr. Tenzhu Yantin, Project Coordinator and Special Educator at Drugstore Vocational Training Center for Special Children and Youth. Thank you all very much for being on the program, La. I'd like to start off with Sarugin, La. Yes. What is the main purpose of your organization, the objective of having such an office, La?
Basically, the Ability Bhutan Society focuses on providing early intervention primarily for children from 0 to 6 years of age. And the main objective of this is to provide the early intervention and make the children ready for the school. So coming into like moderate to severe disabilities, it is sometimes hard to directly enroll into the general school. So which is why Ability Bhutan Society focuses on the provision of services like communication and behavior management, and of course activities of daily living.
Plus, Ma'am Duptopla, the purpose of your organization, the objective of having such an office, La?
Our main purpose is to promote physical, psychological and socio-economic well-being of our persons with disabilities. La.
Yes.
And our objective is to raise awareness and advocate on the rights of persons with disabilities, yes, to promote inclusion and effective participation of persons with disabilities in the community decision making, to enhance the livelihood and independence of the persons with disabilities in the society.
Mr. Tenzin,
I would like to begin by giving a very short description of our organization. Yes. We are called Drugstore Vocational Training Center, yes, for Children and Youth with Disabilities. Yes. We were established in 2001, 2nd of October, with blessings from Her Majesty, the Queen Mother, Ajit Singh Wangchuk. However, we were formally registered as a public benefit organization under CSOA on 26th of November 2010. Yes. Our founder director is Rinzin Pematsogel, and our executive director is Dikizam. We currently have 24 staff members, 12 in Thimphu and 12 in Tashigang, and we provide our services to around 250 students in the country.
Yes.
The vision of our organization is ultimately to have a society in which persons with disabilities will actively and equitably participate in socio-economic development of the country and live fulfilling lives.
Yes.
Our objective as an organization is to ensure that young persons with disabilities in our country have quality opportunities for developing skills, life skills, vocational skills, and educational skills that will help them become self-reliant and help them lead a self-sustainable life, overcoming barriers that are created by the society or gender differences or any other differences.
Now I'm sure that there will be a lot of ample of services provided, but what are some of the crucial services that your organization provide in order to fulfill those objectives, sir, if you may?
So coming to the service provisions by Ability Bhutan Society, it can be categorized into 5.
Yes.
First is the center-based here in Thimphu.
Yes.
Next, we also go for home-based service intervention. So these sort of services are for those children who are not able to turn up to the services for availing the services.
Yes.
And next, once the children from Ability Bhutan Society is transitioned to the general school, we also do follow up on a weekly basis along with the general teachers and SEN program teachers in the school. Yes. And next, we also focus much on empowering their immediate families, caregivers and parents. So this aims to empower and orient parents and their caregivers to provide the right appropriate services at home. And next we have also expanded sort of services for people with disabilities in basically 5 Dzongkhaks with the project support from the German government, Federal Ministry for Economic Cooperation and Development in collaboration with JLR India. So we have projects in Sarbang, Chukha, Dagana, Tashigang and Punakha Dzongkhaks respectively.
Yes.
So coming to the main services, so for children with disabilities, particularly from moderate to severe disabilities, since they lack communication, so at the center based we focus on the development of communication. So when we say communication, those children who are non-verbal, we focus into different strategies. To give an example, like picture communication is a PECS. We also focus on socialization, their behavior management, school readiness, fine motor and gross motor, and of course, as I mentioned earlier, we much focus on the activities of daily living like toileting, dressing, eating and so on and so forth.
Yes, ma'am, do topi for me la.
Before going to the services, I would like to also add 2 more objectives. That is to facilitate the employment and involvement of persons with disabilities in socio-political decision making. And the other objective would be to explore and strengthen the communication, coordination and collaboration with the relevant stakeholders. Keeping these objectives in our mind, the main service provided by our organization in order to fulfill the objectives is to Disabled Persons Association of Bhutan, or we try to address leaving no one behind by providing educational sponsorship. And the second service is providing independence living life skills, living skills and training, independent living skills and training. And third service would be provide emergency medical allowances to persons with disabilities, like travel allowances. When they come for the treatment, we provide TADA to support their traveling allowances to come for the medication. Yes. And the fourth would be creating advocacy and awareness to all the disabilities. Yes. And then the other service would be distribute assistive devices to the needy persons with disabilities.
Yes. Mr. in some of the vital services provided by the center.
Druxo basically provides 4 kinds of services. Yes. We have special education, physical education, life skills education and vocational skills training. Yes. Special education happens during the morning. We have morning academic sessions in which we ensure that we provide literacy skills to persons with disabilities in the subjects of English, mathematics and Dzongkha. Vocational skills, we have 7 types of vocational skills that we train our students with disabilities in. Basket weaving, traditional weaving, tailoring, art and painting, embroidery, souvenir making, wood carving and pottery, etc. Physical education and life skills education happens during Thursdays every week. In line with our vision and mission, our organization is involved in other engagements as well. Currently, we are working with Royal Education Council to have a book nationally adopted by Sense Schools. It's called Instructional Based Life Skills Curriculum for persons with disabilities. And we are also involved in policy making with the government. We were involved in formulating the national policy for persons with disabilities, national gender equality policy, health and physical education curriculum for primary schools and national sports policy. So these are the some services that our organization provides and some of the engagements that we're involved in.
Now, all of us know that ever since the outbreak of the pandemic, a lot of sectors have been hit hard adversely, some even to the extent of shutting down. So, how did the pandemic impact your organization's activities, and how are you adapting to it? Plus, if you may say.
Before I highlight on the impact of coronavirus, I would like to highlight a little bit on the expansion of EV services into the Dzongkhaks. Yes. So with the support from, as I mentioned, like Federal Ministry for Economic Cooperation, the German government, yes, and GLRA India, in 5 Dzongkhaks, we train the service providers and duty bearers such as like ECCD facilitators, school teachers, the health workers, and of course their immediate parents and caregivers as well. So there are provisions of vocational training for persons with disabilities and of course their parents. Next, we also have the provisions of providing assistive devices to persons with disabilities. So for this we work in close collaboration with Ministry of Health and JDWNRH. Then next, we also focus much on making the environment accessible, and of course the observance of disability, International Disability Days, focusing on awareness and sensitization among the public. Yes. Now coming to the impact of the COVID-19, when we say disability, given the vulnerability and the risks, of course we had to immediately shut down our service center here in Thimphu, and of course we were definitely not able to provide the daily intervention services as required for different children with disabilities. However, we have initiated to visit their homes. We also did prepare the communication material for every child. We also prepared the daily schedule to be followed by children at home, and we are also in the process of procuring some assistive technology devices and like iPads and tablets in collaboration with the UNICEF. So we will be orienting not only children but also their parents to guide them at home.
Madam Duktopla.
Before going to the impact of pandemic, I would like to highlight some of the activities that we normally do. Although we have budget to do these activities, yet the pandemic although affect us, but then the activities were almost ongoing. Yes. Before the pandemic, we used to provide, we used to have the activities like conduct independent living skills training, and yes, then such as tailoring, then ICT, mason and spa trainings, such activities. But the pandemic has impacted these conducting these activities. So, but then with the support from international organizations like the UNDP, UNICEF, we had the disability equality training amongst the frontliners. Like if we have a disabled person kept in the quarantine, so we try to train the frontliners how to guide them, yes, how to talk to them, how to cater their needs and so on. So this has also helped us to advocate as well as to give the people, the frontliners, the skill how to cater with the different types of disabilities.
Our organization felt the impacts of COVID-19 on many fronts. Yes. Our students, our parents, our instructors, and Drakso as a whole organization. Beginning of March 2020, as per the instruction from Ministry of Health, we had to close our school, and the management afterwards the management decided that we will have our school closed for the entirety of 2020 to ensure the safety of our students. One difficulty that we experienced was that children children with intellectual disability, it is very difficult for them to even partially understand the concept of a pandemic or viral infection spread in communities. So we had to really work with them to help them understand the situation that our country was facing and the whole world was in. For students with autism as well, because they are so used to a routine, which is coming to the school and then they stay in the school beginning 9 a.m. until 2. They are so used to this routine that suddenly when they are asked to stay at home, they show behavioral difficulties, which become very difficult for the parents to manage.
Yes.
So we have also worked with parents to help them manage behavioral challenges with their children with autism.
That's
Parents, majority of the parents of children and youth with disabilities that are registered with DRUXO have low levels of literacy. So even for them, it is very difficult to, first of all, understand and then practice the intervention methods, the behavioral management strategies. So we had to work together with parents. Also, quite a number of parents belong to low socioeconomic range, many dependent on daily wage. So when the COVID-19 pandemic, when the blows of COVID-19 were felt, our country was starting to feel the blows of the pandemic. Many of our parents also started to lose their jobs, because of which many faced financial difficulties. So we had to be in constant interaction with the parents as well, and see what solutions we could offer to the parents of persons with disabilities. The instructors as well. As soon as this pandemic entered our country, we were focused on ICT in education more, e-learning.
Yes.
Our instructors as of now are inadequately trained for ICT in education. So we have to work together with Ministry of Education as well, should this pandemic go on in 2021 as well, to ensure that our instructors are adequately trained to provide ICT education services to our students with disabilities. And of course, every organization, I think it's the same with all CSOs, we have been facing financial constraint because of the pandemic. Especially our organization is heavily dependent on foreign donors. And tourists, they come in, they give generous donations to our organization. They buy our products as well, products that are made by children with disabilities that are registered with our organization. So now that the tourist entry has been barred temporarily, we have started to feel the impact of that as well. And finally, not just an impact of COVID-19, but a difficulty that our organization face in general is infrastructural inaccessibility. Our organization in the East, DRUXO East, is well equipped, and our infrastructure are also accessible. But however, the offices and the school, the center that we have in Thimphu, as of now, they are inaccessible, and we are facing quite a difficulty with that as well.
Apart from the pandemic, if you could share some of the challenges of your organization.
One of our colleagues did share about the challenges faced by organizations, particularly catering services to persons with disabilities. So if I particularly mention on a few challenges that the organization Ability Bhutan Society faces, although we did adapt to the online classes for parents on some of the techniques, we did have orientation program. We also do seek expertise. For instance, we have a good number of volunteers from Australian Catholic University who are specialized into providing the specific intervention services for children with disabilities. So when the pandemic came in, basically, these were few challenges like having, as shared by our colleague, parents not adequately literate, and of course our own set of staff are not that oriented to providing online e-learning classes. So we at the center, the disabilities, particularly from moderate to severe disabilities, since they require the specific and the professionalized services, so we do lack the professionals. For instance, we do not have speech therapists as of now.
Yes.
We do not also have occupational therapists, and lack of human resources, and we also have the funding constraints. So as we shared, almost all the CSOs in Bhutan are heavily dependent on we are driven by donor funds. So we neither could go for fundraising because of the pandemic, so which is why there is a huge impact on that. And on top of that, we also do not have accessible infrastructure as of now.
Yes.
So which is why for different children and persons with disabilities, the infrastructure, the inaccessible infrastructure pose a serious threat to them in providing services.
Yes, Madam Dutupla.
Some of the key challenges that our organization faces is lack of expertise in disability issues, accessibility in terms of involvement of information. Therefore, our addressing these two challenges, the future plans of our organization is to set up a universal designed center, and then assistive the accessible center for persons with disabilities.
Yes.
Which could be replicated by other GPOs, and support self-help groups, establish support self-help groups.
Yes. Yes, Mr. Tinjala, if you may.
Yes. There are two core challenges that I would like to highlight that our organization faces. First, as I mentioned earlier, and as mentioned by all our panel members, it's the financial difficulty. It's very difficult to cover functional costs that our organization has to bear on a monthly basis. The salaries of teacher. When donors think, usually in the minds of the donors, when they provide funds for organizations, they want to see something concrete, like an infrastructure or a book being published. However, the difficulty that our organizations face is in providing salaries, monthly salaries for our staff members. And then our organization, Druxo, in Druxo East, we provide boarding facilities to students with disabilities, which means that we have to provide fooding, lodging services to persons with disabilities as well that are registered with us. So it's a huge financial drain on our organization because of all these services that we are providing. So we are constantly looking for donors that are willing to help our organization and better the lives of persons with disabilities in our country.
Yes.
And then the second issue that I would like to highlight is insufficient staff members in our organization. Druxo is quite unique in that usually CSOs, they try to minimize as much staff members as possible, employees as possible. But how we at the moment have 24 staff members. We have 14 teachers, and then rest are administrative members of our organization. Because of this, although the number it looks quite large, a lot, 24 for an organization. For a CSO, we have around 250 students to whom we are providing our services. So 24 is still insufficient in my opinion. So human resource constraint is one issue that our organization is facing at the moment.
Thus now, with all the invaluable messages and thoughts from the panel, I hope that our audience watching at home are reminded well about the functions and services rendered by these civil society organizations. Thus, thank you for watching.